Good morning. Today's class is on minerals. Minerals. What are minerals? Minerals are essential for the normal growth and maintenance of the body. There are major elements and minor elements, or macronutrients or micronutrients. Major elements. If the daily requirement is more than 100 milligram per day, then they are called as major elements. They include calcium, magnesium, phosphorus, sodium, potassium, chloride, and sulfur. Minor elements. If the daily requirement is less than 100 milligram per day, they are called as microelements. They include iron, iodine, copper, manganese, zinc, molybdenum, selenium, and fluoride. Now, there are certain toxic minerals such as aluminum, lead, cadmium, and mercury. First, we move on to calcium. Today's mineral for discussion is calcium. Total calcium in the body is 1 to 1.5 kg, and around 99% is present in bones. 1% is seen in extracellular fluid. The sources of calcium. Milk is a very good source of calcium. Other sources are egg, fish, vegetables. And the daily requirement or recommended dietary allowance for calcium. For adults, it is 500 milligram per day. Children, 1200 milligram per day. Pregnancy and lactation, 1500 milligram per day. And above 50 years, 1500 milligram per day plus vitamin D, around 20 microgram per day. Biochemical functions of calcium. First function is the development of bones and teeth. Now, the bulk quantity of calcium is used for bone and teeth formation. And in the bones and teeth, calcium is deposited as hydroxyapatite crystals. Bones are actually reservoir for calcium, and osteoblasts are cells that induce bone deposition, and osteoclasts produce demineralization. Muscle contraction. Calcium mediates excitation and contraction of skeletal, cardiac, and smooth muscles. Blood coagulation. Calcium helps in blood coagulation. That is, there is a factor, clotting factor called prothrombin, and the gamma carboxyglutamate residues in prothrombin are chelated by calcium during its activation, that is, during the conversion of prothrombin to thrombin. Calcium helps in the transmission of nerve impulses from presynaptic to postsynaptic region. And calcium is required for activation of enzymes. Now, there is a protein called calmodulin, which is a calcium binding protein. So, when calcium binds to this calmodulin, it forms calcium calmodulin complex, and it activates various regulatory kinases. Example, glycogen synthase, which is an enzyme responsible for glycogenesis. Then pyruvate kinase, an enzyme of glycolysis. So, these enzymes are activated by binding of calcium to a protein called calmodulin, and this calcium calmodulin complex can activate glycogen synthase and pyruvate kinase. Whereas some enzymes are directly activated by calcium, One such enzyme is pancreatic lipase, which helps in the digestion of lipids. So if we see the calcium calmodulin, when they bind together, it forms calcium bound calmodulin, and it activates a kinase enzyme, and this activated kinase can phosphorylate the target enzyme, and the enzyme will be phosphorylated, and then the phosphorylated enzyme can phosphorylated enzyme will exert its biological effect. Calcium, it can also act as second messenger. It's used as second messenger in systems involving G proteins and inositol triphosphate. So one example is glucagon. It uses calcium as a second messenger. Then release of hormones. Calcium mediates secretion of insulin, parathyroid hormone, calcitonin, vasopressin, etc. from the cells. So calcium mediates secretion of these hormones from its particular cells. Then action on heart. Calcium prolongs systole. In case of hypercalcemia, cardiac arrest can be seen in systole. So, one point to be remembered is when calcium is administered intravenously, it should be given very slowly. Another function is calcium decreases neuromuscular excitability. Again, absorption of calcium. Absorption of calcium occurs from first and second part of duodenum against a concentration gradient which requires energy, and it requires a carrier protein with the help of calcium dependent ATPase. There are certain factors which promote calcium absorption. One is vitamin D, and second one is parathyroid hormone. So these two hormones promotes calcium absorption. Vitamin D actually induces the synthesis of carrier protein calbindin in the intestinal epithelial cells, and thus it facilitates the absorption of calcium. Parathyroid hormone, it increases calcium transport from the intestinal cells by enhancing 1-alpha hydroxylase activity. That is, parathyroid hormone converts vitamin D by hydroxylating it at the first position to form the active form of vitamin D. So, once vitamin D is converted to its active form, it facilitates the absorption of calcium from intestinal epithelial cells. Other factors favoring calcium absorption is the acidic pH, so that favors calcium absorption. Then amino acids such as arginine and lysine also increase calcium absorption. Maximum absorption of calcium occurs when optimum calcium to phosphorus ratio is between 1:2 to 2:1, and this optimum ratio can be provided by milk. Now there are certain factors which inhibit calcium absorption. They are phytates and oxalates. These phytates, they are present in cereals. So they can they can inhibit the absorption of calcium. Similarly, oxalates, they are present in some leafy vegetables, and they cause formation of insoluble calcium oxalates. So they inhibit calcium absorption. Then high dietary phosphates. So when there is high phosphates in the diet, they cause precipitation as calcium phosphate, thereby inhibiting calcium absorption. Then in case of malabsorption syndrome, in here fatty acids is not absorbed that cause formation of insoluble calcium salt of fatty acid. So in this case malabsorption syndrome also it inhibits calcium absorption. Next we come to regulation of calcium level in blood. It is also known as homeostasis of calcium. Now this is very important. Normal serum calcium level is 9 to 11 milligram per dl and around 5 milligram per dl of calcium is present as ionized calcium, and that is the metabolically active form of calcium. 1 milligram of calcium is complexed with phosphate, bicarbonate and citrate. This form of calcium is diffusible from blood to the tissues. Around 4 milligram of calcium is bound to proteins, and this protein bound calcium is non-diffusible to tissues. So if you see ionized form of calcium is the highest, that is 5 milligram. The one complexed with anions is only 1 milligram and one bound with proteins is around 4 milligram per dl. There are different factors which regulates plasma calcium level, and these factors are calcitriol, parathyroid hormone and calcitonin. So first we have calcitriol, or it is the active form of vitamin D. It is also known as 1,25 dihydroxy called calciferol. So vitamin D, its action is that in the intestinal cells it increases the absorption of calcium and phosphorus. It induces the formation of calcium binding protein, calbindin. Okay, so we already said it induces the synthesis of a protein, calbindin, and this calbindin helps in the absorption of calcium. In the picture we can see this vitamin D3. Vitamin D3 is known as cholecalciferol. It is formed from 7-dehydrocholesterol. 7-dehydrocholesterol upon exposure to sunlight. 7-dehydrocholesterol is converted to cholecalciferol, which is vitamin D3. Now this vitamin, it has to be activated. So in the liver it is hydroxylated at its 25th position to form 25 dihydroxyvitamin, and again it is taken into the kidneys and there it is hydroxylated at the first position to form 125 dihydroxy called calciferol. So this is the active form of vitamin D, and this 125 dihydroxy called calciferol, or it is otherwise known as calcitriol, it increases calcium absorption in the small intestine, that increases calcium reabsorption in the kidneys, and it increases bone mineralization. So in the intestinal cell, calcitriol, it actually binds with vitamin D receptor, and this complex interacts with the DNA, and it leads to transcription and translation, thus synthesizing the protein calbindin, and this calbindin increases calcium absorption, thereby it increases the blood calcium level. So once again, in the blood, this calcitriol, it is binds with the receptor, and this calcitriol receptor complex enters the nucleus, and it binds with the DNA, and it causes transcription and translation, uh, that is by synthesis of calbindin protein, and this calbindin absorbs calcium into the intestinal cells. Now, action of vitamin D and bone. Now, this vitamin D increases mineralization of bones by increasing the activity of osteoblast cells of bone. Now, vitamin D actually increases the activity of osteoblast cells which are present in the bone, and it increases the mineralization of bones. It increases the ionic product of calcium and phosphorus, causing mineralization and remodeling of bone. That is, it increases the bone density. Now, action of vitamin D in renal tubules. Calcitriol increases reabsorption of calcium, and it decreases the excretion of calcium through the kidneys, and thereby increases the serum calcium levels. So, calcitriol, it increases reabsorption of calcium. So, it increases the in the blood, the serum calcium level will increase. Next is parathyroid hormone. Parathyroid hormone, it is secreted by the chief cells of parathyroid gland of thyroid tissue, and this parathyroid hormone, it is synthesized as in an inactive form, which is pre-pro-PTH, made up of 115 amino acids, and by cleaving this pre-pro-PTH, and it is converted into the mature form, which contains 85 amino acids. Now, parathyroid hormone, its action on bone, it causes mainly decalcification and demineralization of bones, increasing blood calcium level. So, unlike calcitriol, here parathyroid hormone is causing demineralization of bones. So, calcium is not entering into the bones, thereby it increases blood calcium level. And PTH, actually it increases the number and activity of osteoclast cells of bone. And osteoclast cells, these cells, they cause bone resorption. So we have to remember one thing: osteoblasts are cells which increases the bone formation, whereas osteoclast cells causes bone resorption. Again, action on kidney. Parathyroid hormone decreases renal excretion of calcium and also increases phosphate excretion. So that is, it increases reabsorption of calcium from kidney tubules. So parathyroid hormone, it is increasing the reabsorption of calcium from kidney tubules. Thereby, it increases the blood calcium level. Again, action on intestine. Now, parathyroid hormone, it stimulates the activity of enzyme 1-hydroxylase necessary for activation of vitamin D to calcitriol. So we know vitamin D, when it is converted to its active form calcitriol, it is hydroxylated at its 25th and 1st position. So the first position is hydroxylated by the enzyme 1-hydroxylase or 1-alpha hydroxylase. So this enzyme is activated by parathyroid hormone. So thus parathyroid hormones converts vitamin D to its active form. So once it is converted to its active form, calcitriol, it increases the intestinal absorption of calcium. When the calcium level is low, PTH secretion is stimulated and it increases the blood calcium level. So PTH is being secreted when the calcium level is low. That time PTH secretion occurs and it increases the blood calcium level. Next is calcitonin. Calcitonin is secreted by parafollicular cells of thyroid gland and it is stimulated by calcium, gastrin and glucagon. Calcitonin, it can be increased in medullary carcinoma of thyroid, so it is an important tumor marker. Now calcitonin, it is antagonistic to the action of PTH, that is it decreases calcium level. Unlike the other hormones, parathyroid hormone and also calcitriol, they actually increases calcium level, but here calcitonin decreases calcium level. What it does is that it promotes calcification of bones and it inhibits resorption. So, calcitonin, it increases the activity of osteoblasts and causes deposition of calcium in the bones. Again, calcitonin, calcitriol and PTH act together. So when the blood calcium level is low, PTH secretion is stimulated and calcitonin is inhibited. This leads to bone demineralization and there is increased blood calcium level. And when the blood calcium level is high, PTH secretion is inhibited. That time calcitonin is secreted and this calcitonin causes bone calcification. So the calcium, there is entry of calcium from blood to the bones. So that time the blood calcium level will decrease. Now here we can see how the plasma calcium 9 to 11 milligram per dl, how it is maintained. We know first the vitamin D, it is converted into the active form calcitriol. Parathyroid hormone also helps in the conversion of vitamin D to its active form. And this calcitriol, it increases the intestinal absorption of calcium and thus it adds to the plasma calcium level. Again, calcitriol and calcitonin. Both calcitriol and calcitonin causes bone mineralization, whereas PTH causes demineralization. Okay, demineralization of bones. So that time calcium from bones enters the blood. So calcitriol and calcitonin causes bone mineralization. PTH causes bone demineralization of bones. Then PTH and calcitriol, they causes renal tubular absorption of calcium. That is PTH and calcitriol causes reabsorption of calcium in the kidneys. So that will increases plasma calcium level. So this is how calcitriol, PTH and calcitonin act together to maintain the plasma calcium level between 9 to 11 milligram per dl. Now calcium has a reciprocal relation with phosphorus. The ionic product of calcium and phosphorus is 40. That is, calcium is its concentration is 10 milligram and phosphorus is 4. So that is how we get the product 40. But in case of renal insufficiency, phosphorus excretion is diminished. So phosphorus level increases in blood and calcium level, it gets decreased leading to a condition called tetany. Next is disease states. First one is hypercalcemia. So if the level of calcium is more than 11 milligram per dl, then we can say that is hypercalcemia. And this can be due to hyperparathyroidism. So the clinical manifestations C include osteoporosis and bone resorption. And the X-rays of skull and bones show punched out areas of bone resorption. There is increased calcium and alkaline phosphatase activity in blood. Then phosphate level is decreased. There is elevation in urinary excretion of calcium, that is hypercalciuria, leads to it also leads to deposition of calcium in urinary tract, causing urinary calculi. Then there is deposition of calcium in renal tissues, then pancreas, arterial walls and muscle tissues also. So these are the clinical manifestations in hypercalcemia. Osteoporosis, it is seen in the people above 60 years of age. So osteoporosis, in case of osteoporosis, the bones are highly susceptible to fracture. That is, there is fragility of bones can be seen. So there is tendency of the bones to get broken. So that is osteoporosis. It is commonly seen in old age people. Next is hypocalcemia. That is calcium deficiency. So here serum calcium level is less than 8 milligram per dl. Then mild tremors can be seen. If the serum calcium level is below 7.5 milligram per dl, it leads to a life-threatening condition called as tetany. And this can happen in case of accidental surgical removal of parathyroid glands or by autoimmune diseases. Here, in case of tetany, neuromuscular irritability is increased, which causes spasm of muscles. The clinical manifestations include carpopedal spasm, then laryngeal spasm lead to death. So that is the vocal cords, there is spasm, and that can lead to death. Then Schwarzenegger's sign, that is tapping over facial nerve, can cause facial contraction, and Trocheus sign is observed. Trocheus sign, that is inflation of BP curve for 3 minutes, it can cause carpopedal spasm. So these signs are observed in case of tetany. Then chronic dietary deficiency of calcium can cause bone resorption, leading to osteoporosis in old age. So there is a bone disease with increased risk for fractures. There is reduced bone strength. And causes for osteoporosis is decreased absorption of vitamin D and reduced levels of androgens and estrogens in old age. There is decrease in serum calcium level but increase in phosphate level. So here you can see the normal bones and the one which is seen in osteoporosis. So the bone strength or bone density gets decreased in case of osteoporosis. And this is Schwarzenegger's sign and carpopedal spasm. Again, calcium deficiency is seen in case of inadequate dietary intake, then hypoparathyroidism. Now, treatment for hypocalcemia is that supplementation of calcium in combination with vitamin D is recommended. So, we usually give calcium along with vitamin D because vitamin D is required for absorption of calcium from the intestine. Okay, with that we finish class on calcium. Thank you.